relationship capital is like the most valuable thing that I had in my offices. And that means that if you've got somebody who's been there for a long time, they've got relationships with the patients, they've got relationships with one another, they've got a relationship with me, they have a relationship with the office and where things are and how things work and all that sort of thing. And, if I hear another corporate entity say, oh, we'll just backfill that position, talking about human beings as backfill is something that makes me want to scream. Because guess what? When you're just looking at a spreadsheet and saying, oh, this person costs too much, we'll do without her. It's an absurd thing to think that you're going to replace all of that relationship capital with somebody new who's going to plug in without any of that and is going to be starting over from scratch. It's a hell of a lot more expensive to lose a great team member than it is to, it's more expensive to replace them than it is to maybe pay them a little more, or show that appreciation. And I think sometimes as dentists, we're busy and we focus on the things that aren't going well. We focus on correcting. And oftentimes we don't focus enough on that affirmation. And if you can't focus on that, then you're not going to have a great rapport with your team. Whether you're best friends with them or not, you got to show the appreciation and affirmation of a job well done, because every study shows that obviously money is a big deal for team members. They got to have money to pay their expenses and have a nice lifestyle and have some freedom. That's super important. But just as important in almost every poll or study I've ever seen, that affirmation piece, that feeling appreciated, feeling empowered is every bit as important. And I think through the pandemic, as teams really struggled to retain those good people, I think that as they lost those people, cultures kind of declined, morale started to decline. And now it's harder than ever, I think, to recruit those really great people. And so what I tell people is like, pay above market. If you've got a winner, pay above market, because they're worth a lot more than that. I can promise you right now. Take care of them in every way. Make sure that they feel appreciated, make sure that they feel important, and that they have some ownership in the practice.
I was saying, before you go on, I just want to mention another quick. I
Go
think
for
as a leader, it's very important for people to really be psychologists, because they are working with human beings, like they're not working with robots. So many times we forget the fact that these are human beings, that they have values and they have a life for themselves. There are things, they have visions, they have passions that they are following. And if we can line up those passions with what we have, then no matter, even if you are giving them minimal payments, I've tested this, they're going to work way better than someone you would hire for 20x that salary. I have that kind of experience.
Yes. You know what? I think that, absolutely. I think that as a young dentist, I felt like I was in a state of panic half the time, and I was so overwhelmed and like had all this work that I took home with me and everything, that I don't think that I was as focused on the affirmation as a young dentist. I think I was focused on correcting, because I was panicked and I was coming from a place of scarcity, because I was just worried about, oh, am I going to pay my bills? When you get to a point where you change that mentality, even if you don't have it all, like if you come from a place of abundance, like people get it. And abundance means sharing with them. It means appreciating them. It means not just focusing on the negatives. And once I crossed that Rubicon, holy cow, like everything changed. And guess what? Patients started saying yes a hell of a lot more. When I basically, not that I didn't care, but it was like, look, man, this is what I would do for my own mouth or for a member of my family. But at the end of the day, it's your mouth. And it's your budget, and, I can't make the decision for you, and my feelings aren't going to be hurt. But until you get to that point, I think that it's difficult to get buy-in from your team. It's hard to get buy-in from patients.
Yeah, totally. Thank you so much for that.
Awesome. I've got a slightly bit parallel kind of question to ask you in that area of getting the right people, getting the right team members, hiring specifically. You must have some really nice, good questions that you ask people that are interviewing you. I always like to ask certain people, share some really good interview question that you get the most value, you get the most character out of that person. Do you have that one question that you always ask?
I don't. And I never followed any particular structure. I always had conversations. I'd certainly ask them something about their resume, about their experience, and get a feel for how they deal with certain situations, certainly. But honestly, when I was interviewing people, it was more about getting to know them and to see if we had the right vibe, where I felt they'd fit in well with my team. It was more getting a feel for them. And I think when I was younger, I did. I'd go down that checklist and check this, and where do you
Yeah.
see yourself in 5 years, and
Yeah.
all these kinds of things. And I was hiring based on those check marks as opposed to how I felt when I was with that person.
That's a very good answer. I love that. That's absolutely spot on and season on. So that's a great content to have for people that are watching and listening to this.
Good. I hope so.
Absolutely. All right. Dr. Mila, do you got any more questions? I've got one that I can ask, but any more questions that you've got, Dr. Mila?
Well, I have a lot of questions to ask Dr. Jim Arnold, but I'm sure that he's probably tired of all of us by now. He's like, how with you guys?
Hey, guys, I'm enjoying the conversation. I mean, we could be having the same conversation, sitting next to a bar that we're having right now.